Today, we get to meet the new CEO of Daviess Community Hospital, Justin Harris, joining us this morning. We'll find out a little bit about him, some plans for the hospital's future, and we're just going to chat for a bit, basically. First off, Justin, thank you so much for sharing some time with us this week on Focus.
I'm glad to be here. Really excited to be in our community and be involved, and just I'm excited. It's great to be here.
Well, we got to start with a little background about yourself, as you're one of the newest members to the community. Tell us a little bit about yourself and your family.
I am. Yep. I will say I am a girl dad. I've got all girls and females in my family, so I've got 3 girls, all under 10. So a little full house.
You're
and,
busy.
The dogs are girls. Everyone's a girl. So it's just me, but have a great family, wife, 3 kids, and my wife's from Henderson, Kentucky, and this is home to us, and we are excited to be here and be here in the future.
Well, give us you got over a decade of healthcare leadership, I understand. Give us a little background about where you've been and what you've done so far.
I do. So I went to school down at UAB, University of Alabama at Birmingham. And from there, I really wanted to focus in rural healthcare, community healthcare. And so I joined a company that was solely focused in rural healthcare. My first hospital was in Eastern Kentucky, a small town in Eastern Kentucky, and just great people. And I feel it's a better way to be invested. It's a better way to know people, to be involved. It's easier, I think. And so just really enjoy the ability to connect. And that's why I want to be here. That's why I made the transition. And our board has the passion for growing our facility. So just excited to be in rural healthcare and my experience in rural healthcare. Been in physician practices as well. I've been in a couple recently, and with ortho and general surgery and vascular, neurosurgery, and so that aspect of healthcare is different than hospitals, in that I really get to work and connect with our physicians and our surgeons, and so I will bring that here. I think in the first couple weeks or so of being here in Washington and in our hospital, I've been able to connect with our docs, and I want them to know that we're going to do this together. We're on the same team. We know where we want to go, and we know the growth that we want, and so I need them just as much as they need me. And so it's a true partnership, and I really value that to bring to our facility.
Well, and hats off to you for tackling, rural healthcare. Let's face it, Justin, it does have its challenges. We know that, and we hear about it. It seems like every day more and more in the national news now, especially. Certainly. But we also know that without rural healthcare, I mean, in a community like Washington and Daviess County, I cannot begin to imagine, and I stress this every time I talk to anyone from the hospital on the air, cannot imagine our community without our local hospital. I mean, seconds saves lives. We know that, and yes. we are just grateful that we have a facility like Daviess Community Hospital here in this small area.
First and foremost, we will continue to provide great quality care for our residents, our communities, and in our city. The hospital is an important aspect of who we are here, and we will, it takes a good hospital and a good school system, right? And if you don't have one of the two, it's hard for communities to survive. And so to know that the backing of the city and the support that they give us and the hospital, the backing of our board and the support that we have through our board of directors, and our great employees and our great docs. And so we will grow our organization. There's a lot of opportunity that we have at our hospital, no doubt. But there is that opportunity is to capitalize on. And so that's why I came here, because everybody wants that. I always say you can't make people want something, but if you do, man, I give the energy to go get it. And we can do that together. It's a team approach. Well,
and we have a awesome team of physicians on staff, and I think that's probably one of the biggest challenges in rural healthcare is not only finding the doctors and physicians, but attracting new ones to our area.
We do. We have great medical staff that are committed to our hospital, whether it's family practice and internal medicine, whether it's surgical specialists, our ER docs, hospitalists. They're committed. They are committed. one thing I really enjoy is physician recruiting and provider recruitment, because I like to sell who we are. I like to sell what we believe in, what our town is about, the history of where we live and what our town has come through over the years. And I can really get physicians and providers to buy into that and be excited about it. I want providers to be excited about who we are, not just come here and employees too, not just come and collect a paycheck, but really investing in who we are. So yes, we will be recruiting more family practice and internal medicine providers into our community, because this is not a dying community. It's not a stagnant community. There's growth in our towns, and so we need to meet that need. So we need more family practice providers, and with that, we'll have more specialists. They will come as well. But we have good surgeons to provide good care, high quality, from OB to orthopedics. It's a good thing to have.
And you ask any doctor, and they're going to say they're only as good as the nursing staff behind them. Nurses are so important too.
100%. And I will elevate our OB staff first and foremost, because OB is a pillar in our community here. The obstetric services, we have a level 2 obstetric department, a level 2 nursery with the state, and we are able to keep 99% of the babies that we deliver here in Washington. We had over 500 deliveries last year, and I've been at multiple places, and 500 deliveries for our size of facility in our community, that's outstanding. And we transferred less than 10 babies last year, and are on track to do less than that this year. So we're elevating our care, and that goes back to the staff. It goes back to the providers and their education on both the nursing staff and the provider base. So really I'm in awe to our staff there in that department, but across the board as well. Our OR staff and our med surge on the floor as well. Just outstanding, the quality of care.
I'll speak from personal experience. Any experience I've had at the hospital has been great, top to bottom. All the staff has been amazing and treated us so well. So I'll put that personal plug out there, completely unsolicited. Never had a bad experience at DCH, and it never will.
Well, thank you.
There's a lot of talk about the management transition now, your affiliation with Deaconess. Can you tell us a little more about what this means? Some people may have some questions about this.
Yeah, so we have been in a management agreement with Ascension since 2017. First and foremost, we are appreciative of Ascension and what they have done. More so even through COVID. COVID was a difficult time for us all, change in daily life, and Ascension really provided great support for this hospital during that time. And so, as we're looking into the future over the next, 2, 3, 5, 10 years of healthcare and what Washington needs, what the hospital needs to deliver to our community and residents, the board went through a rigorous RFP, a request for proposal process, to determine, who was the right next partner for us. And so just before I got here, they made that decision to choose Deaconess as that partner for the next several years, foreseeable future. And so we are confident in that decision and where we want to go. Deaconess has grown substantially over the past 10 years. They just were in Evansville, and now they're in Kentucky, Illinois, throughout Indiana, southern Indiana. And so, they are very committed to keeping care local. The goal is not to end services. The goal is to not remove the providers that maybe are Ascension providers in our specialty clinic. They will continue to stay. Ascension will not pull those providers, so there won't be a delay of care or a gap in coverage. And so, first and foremost, Deaconess is committed to ensuring that we keep patients in our ED and can provide care that we need, not transfer patients out, maybe open more beds on the floor to allow more patients to stay in our community and not have to be transferred. And you see that across the communities that they're already in. You see that in Henderson, Kentucky. You see that in Marion, Illinois. And so you will see the same here locally. So it'll be a good transition. transition. That effective date is October 1st of this year. But the transition will be over, the next year, right? There's a lot that is entailed with that.
And the average person will not see much difference at all, if any. I guess the big question would be, are any providers with Ascension not going to be here anymore? I'm sure that's probably the number one question people have.
And they will stay. They will stay, right? So I'll just focus on Dr. Oates, for example. Dr. Ethan Oates, he is one of our cardio docs that come here from Ascension in Evansville. He's more local for us, actually grew up around here, and so he will continue, right? He is committed. He wants to be here. Ascension wants him to be here, right? Ascension is not wanting to pull their providers just because. If they're providing good care and they're busy, Dr. Oates is a great provider for our community. And so, yes, that he will stay, and the others as well. We are working through that transition period, and so there will be a build upon those providers as well.
Very good. Again, we're talking to Justin Harris, the new CEO of Daviess Community Hospital, learning more about him and plans for the future at our hospital. One of the things going on now, and it's just about to wrap up here in the coming days, is the health needs assessment survey that's going on. We want to put a final plug in there, Justin, because this is so important. Everybody's input is needed, and these are going to close July 31st. So if you haven't filled out that assessment, please do so.
Yeah, please do that. It is a way for us to hear from our community and hear from you on what you feel we need, what we don't have, maybe the services that we need to bring to our community. What do we need to expand on? Maybe things we don't do well and we need to get better at, right? Everyone can be better, right? There's always an up. If you're ever complacent, then you probably should change what you're doing. So let us know. We want to hear from you. We had the opportunity to meet with some of our Amish community leaders last night, and they shared with us what we do great, what we can do better at, how can we provide better services and more services for their communities. So more than happy to hear from you, and we want to from our community.
And you do listen to those surveys. I mean, you've gotten some great feedback, and you've acted on the information you've received over the years when these have been done.
100%. And we want the community to hold us accountable for that. We do. It's a two-way street, right? We want you to come to our hospital and receive services, and we want to know why you're not. Right? And if that's something that we can, again, do better or bring to our community, then we want to do that.
DCHosp.com/CHNA. You can find that survey. It's in 3 different languages, English, Spanish, Haitian, Creole. So we want to make sure everybody gets the opportunity to fill that out. But again, July 31st is the deadline, so make sure you do that. Let's highlight some services. Radiology at DCH.
Yeah, so radiology, we just got a new MRI machine this year. So it is state-of-the-art that you would see at any other facility, whether it's a big city or Evansville or Indianapolis. Our new MRI machine, fantastic. Our orthopedic surgeon, Dr. Thorne, is pretty excited to have that. Our ER docs as well. So really excited to bring that to our community. That's a huge addition for us.
General surgery?
General surgery, yep. 2 great general surgeons, Dr. Kuritz and Dr. Stevenson. Great team, came from Jasper, so we really have the opportunity to build upon what the practice that they had there in Jasper and now providing here in our community. But great surgeons, both from a general surgery perspective, whether it's your gallbladder or it's GI work. So whether you need a scope, make sure you get your preventative scope, and you want to prevent and ensure that the care that you get is here local.
What about primary care? Talk a little bit about that.
Primary care, Dr. Lamb, Dr. Anna Lamb, Dr. Holsopple, Dr. Garrett, and Dr. Nibel are our 4 doctors for family practice and internal medicine. Always available. Always can take new patients, and if you need an appointment here locally, let us know. Be happy to help you with that and schedule that with you.
This is a big one, behavioral health. Behavioral health services. We have got some great programs to help, whether it's in the peer recovery program or just simply talking with someone. If we can help you, we want to. And then 2 new ones, fairly new anyway. We've been talking a lot about these, the limited echoes and the calcium heart scans. Those are so cool. And again, that was one where you listened to the community's input and came up with these and are now providing these. Thanks to Dr. Oates, too, for doing a fantastic job with it.
100%. We have had some great feedback on both of those services already, and just the preventative nature of, hey, we're seeing this, and this is the next step we need to provide for you. And again, we were able to do that here locally, right? You don't need to go to a big city where you're a number. No one knows your name. We know you. We want you to come into our hospital, call you by name, and provide that service that you need and that you deserve right here in Washington.
Well, and you're coming at a good time. Lots of great improvements have happened over the past few years at the hospital as well.
100%. We are investing into our hospital. The money that we make at our hospital is just to reinvest into our facility. It's to reinvest into our people and ensure that they are getting paid appropriately, the benefits are good, but more importantly, here for the long term. We are One important thing to note about the change with Deaconess, we are not being bought. We are not losing control, right? We have full control of our facility in partnership, of course, with the city. It's a city-owned hospital and will continue to be a city-owned hospital. Decisions that are made here locally with our board, with myself, in conjunction with the city. And so it is important to note that nothing is going outside of Washington, and we are sustainable for the future of our city.
And I'm glad you brought that up because we need to dispel the rumors, and we see the social media stuff all the time, and,
Certainly.
and there's no fact checks. Everybody just sees it and puts the panic button immediately, and the number one thing that started circulating immediately was closing, DCH closing. Couldn't be further from the truth.
Couldn't be further from the truth. And I just encourage you to call us. Ask us. You can call me. I'll be happy to talk with you and let you know. Nothing is a secret, right? So I'd be happy to share with you what the Deaconess agreement entails as far as the local ownership and the local decision making. The article that has come out in the paper, right, about the hospitals, might close, right? These hospitals couldn't be farther from the truth. That is old information. Some of those hospitals aren't even around anymore, right? So it's not even accurate information. So I would encourage you to just call us. Dallas is our marketing manager. She does an excellent job. She'll be happy to talk with you. Myself, I'll be happy to talk with you. Jenna, our CNO, Dave, our COO, April, our CFO. Any of us would be happy to talk with you because we are a community city-owned hospital. We're your hospital. And we want you to know, and we want to be very transparent with you.
Very good. Well, and you're going to be out in the community in full force, Can't wait for the golf scramble, just a couple weeks away for the foundation on August 7th. That's always a good time.
No doubt. We are excited about the golf scramble. I'll be out there. Wouldn't tell you that I'm any good at it, but I'm going to have a good time and excited to meet more of our community. Our pickleball tournament was just about a month or so ago. Had great turnout with the pickleball tournament. Was excited about that. Over $20,000 raised. And we had our Derby Gala earlier this year. Great money raised for our foundation, which in turn buys equipment, invests into our hospital. So really appreciate our foundation and what they do for our facility.
So you are also breaking the rumor that all CEOs are good golfers, then, is what you're saying?
You know what? I would tell you that if I was a good golfer, I probably wouldn't be as good at my job, and so I think those two go in hand. I try to play more of a social aspect and getting to know people than actually being maybe good at the game.
Will you guys be locating here, or are you making the trip, or what's the plans on that?
Yeah, so really evaluating that and what that looks like for us and our family. Been in Evansville for a couple years, and so just evaluating what that looks for us.
Well, Justin Harris, great meeting you, great catching up with you. Folks, reach out to Justin anytime. He's there at the hospital all the time now, in full swing. It's been a great transition, no complaints there. Lots of exciting things happening at DCH. And if you ever have any questions, as he said, the phone's always open. Reach out, stop by, talk to the management team, and they'll be glad to answer any of those questions. I'll leave the mic open real quick for closing. Anything else you'd like to get out there, Justin?
Excited to be here. We have great opportunity here at our hospital, and I wouldn't have joined the team if I didn't think otherwise. And so I'm just excited to be here at our hospital. The board has a great support for our facility. The city has a lot of support, and so we're excited about bringing more services to the citizens and residents of our community, our county, and the city around us. So excited to be here. Glad to be involved.
Well, welcome. We're glad to have you. Look forward to working with you lots more in the future.
Certainly. Thank you.
Thank you very much. Justin Harris, the new CEO at Daviess Community Hospital, this week's guest on Focus on the Community. You can download a podcast of today's show by visiting our website at WAMWAMFM.com. I'm Dwayne Shake, inviting you to tune in each weekend as we shine a spotlight on a topic important to our community and focus on the community here on WAMW.